Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Benazepril. Its brand name is Lotensin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. In this video, we'll talk about the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe this medication. We'll then discuss examples of dosing and then follow it up with side effects with percentages. I put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So benazepril hydrochloride inhibits angiotensin converting enzyme or ACE. It's believed to lower blood pressure by suppression of the renin-angiotensin-aldosterone system. Inhibition of ACE blocks the conversion of angiotensin 1 to angiotensin 2. This causes a decreased vasopressor activity and decreased aldosterone secretion. In terms of indications or reasons we would prescribe this medication to a patient, we only really see this medication used in the treatment of hypertension or high blood pressure. With respect to contraindications or reasons we would not be able to prescribe benazepril, we wouldn't give this medication to a patient who had a hypersensitivity to benazepril, any other component of the formulation, or other ACE inhibitors. This medication is not to be used with aliskiren in diabetic patients. It also should not be used with niprisoline inhibitors such as sacubitril. As well, patients with a history of angioedema would not be prescribed this medication. Now for some examples of dosing. So in the treatment of hypertension or high blood pressure, the initial dose in patients who are not using a diuretic would be 10 milligrams orally once daily. For a maintenance dose, we would typically see 20 to 40 milligrams orally once daily or in 2 divided doses. Doses up to 80 milligrams per day have been used, but this dose lacks robust evidence. The initial dose in patients who are using a diuretic would be lower. In this case, it would be 5 milligrams orally once daily, with the maintenance dose being the same as 20 to 40 milligrams orally once daily or in 2 divided doses, and the maximum dose again at 80 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using benazepril, so I'll go over some of those here now. Some patients may experience hyperkalemia or high potassium levels. About 3.5% may experience dizziness, while 1.2% may experience a cough. Fatigue seems to happen 2.5% of the time. 2 serious side effects would be intestinal angioedema and Stevens-Johnson syndrome. Alright everybody, that's all we're going to talk about today with benazepril or Lotensin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. Good for today. Take care.